Well, tighter COVID restrictions are set to remain with us through Christmas and into the new year. And you may have some questions ahead about the holidays and about what's safe and what's not. So here to answer those is BC's Deputy Provincial Health Officer, Dr. Réka Gustafson. Thanks so much for joining us, Doctor.
My pleasure.
So Christmas is just a few weeks away. What do you say to people who plan to ignore the rules blatantly and celebrate with those outside of their immediate household?
Well, I think what we really need to think about today is that we are all together in this effort to dampen transmission. We need to do what we can to reduce transmission in our community, to keep ourselves and our loved ones and our community safe. And sometimes I think people who consider celebrating with others even assume, well, I'm only putting myself at risk. But keep in mind that every single person who gets sick could transmit to someone else. And if you're in hospital, if you end up in the ICU, it's an enormous pressure on your family and on the healthcare system. So by protecting yourself, you're actually protecting others. And so it is a difficult time for everybody. It's a brief time for in the big picture, and I think we have demonstrated in British Columbia what we can achieve when we work together.
I got a lot of questions coming in, Dr. Gustafson. Here's one from Jennifer. We're getting a lot of questions about the bubble. I think there is a lot of still confusion about what a bubble is. I don't know why there is, but there appears to be. Here's one from Jennifer. What is considered your bubble if you're living alone? And with the restrictions that are in place through the new year, can grandkids see their grandparents if they visit them on a regular basis and spend time with them at Christmas?
So generally, if you're living by yourself, your bubble would be considered people up to 2 people with whom you interact regularly. And again, it's important to keep in mind that these rules that we provide people is really to help understanding and sort of getting into the details of exactly what is or is not your bubble can be a little bit difficult. What we recommend for people is to interact with their immediate household, or if they're living alone, with a very small number of people with whom they interact regularly. And the recommendation is 2 people. And that's to keep, to help people understand what is an essential interaction that you have every single day versus a social interaction that you can choose not to have for a brief period of time.
Dr. Gustafson, we want to talk about vaccines now. We've had a lot of questions about this with all the positive news on the horizon. We have one from Twitter that says, after you get the vaccine, do you still need to wear a mask, social distance, etc.? And does getting it make you asymptomatic? And are there any side effects?
So there's a lot of questions. Is that once you're immunized with 2 doses, we have some very encouraging data that implies that you are protected. But one of the things that we are likely to recommend until while COVID-19 is being transmitted in the community is that people maintain the social distancing, the hand washing, the mask, the wearing of masks when required, and that's because it is important to remember that this is something that we do together, and when you're walking down the street, people don't necessarily know whether you are immunized or not. And so it is important that until we reach that level of community herd immunity through immunization that actually reduces transmission, there will be ongoing risk to others, even if you are yourself protected. One of the things that we want to know as we monitor vaccination is what proportion of the population will need to be immunized before transmission is completely stopped. With respect to side effects, again, the vaccines aren't yet approved in Canada, though we expect that to happen imminently. What we know is that the side effects that have been reported are the ones that are common with vaccination, which is redness, some pain at the injection site, sometimes some muscle ache, some fatigue. So all the kinds of side effects that can be managed very easily at home and are very common and not particularly concerning around vaccines. And if you don't mind repeating the third part of the question, I don't remember what the other part was.
I think you already answered it. It was about the side effects. So you nailed them all. Thank you.
Okay, the Premier said earlier today that 4,000 high-risk people will be getting vaccinations by the end of next week. Sharon wants to know, how will the first groups be notified of their vaccination? Should people who are 80 plus contact their family doctor, or will it be like the regular flu shot at the local drugstore? I know we're going to hear some details tomorrow, but can you shed any light on that?
So the exact mechanisms of set of people will be identified is going to be shared in the coming days. Of course, this is a situation that is evolving very, very rapidly. We know that our priority groups are going to be people who are older and also people who work in long-term care facilities. So we have mechanisms to identify individuals, certainly the smaller number of individuals who are in those groups, and each site will be notifying those individuals. So at the moment, we would not be asking people to contact their local pharmacy. This is a very small number of vaccines at the very beginning, and the implementation will be rolled out stepwise over the coming weeks.
More broadly speaking, I've heard a lot of questions about this as well. People don't want to be in that first group to get it or be the guinea pigs, as they call it. What do you say to those people? And if they choose not to get the vaccine, at least not right away, what does that mean for them? Do they have to mask and physical distance indefinitely?
Well, I would say that vaccinations are one of the most successful public health interventions we've had in this century and in the previous century around the world. Vaccines are safe, they are effective, they protect you from an infection that is normally not just a risk to you, but as you see, it's turned our world upside down. So the way I see vaccination is that the fact that these vaccines have come to market is a testament to our determination and ingenuity of all those folks who were involved in the development of the vaccine. And I would encourage everybody to receive the vaccine as soon as they can to protect themselves and to protect those around them. Vaccines work in not a very mysterious way. They teach your immune system how to respond to a virus when you actually meet the virus. It's like exercise for your immune system. And the way you exercise varies from one vaccine to another, but the basic concept is the same. So I think I'm very, very confident and very encouraged by the fact that this vaccine is coming to the market. And we know that COVID-19 can have significant effects for you, and especially your loved ones if they are older, and vaccination is your best bet.
Okay, here's one emailer asking, our son is getting married in 2 weeks, so just before Christmas. Can we have a dinner with just the immediate families?
So again, at the moment, so the answer is, sorry, I just need a moment. So we do not, at the moment, dinners that would involve multiple families are prohibited. So at the moment, while there can be a wedding ceremony with a small number of people, the reception afterwards is not permitted at this time. That would be considered a social gathering.
Just one last question here, Dr. Gustafson. I mean, we've had these restrictions in place now for a number of weeks. The daily case count remains high. Is that a surprise to you? And should we have seen more of a drop-off more quickly than now?
Actually, no. I would say that the number of cases have flattened. I think we need to, we are seeing a flattening of those cases. And this is actually around the time that we would expect to start seeing significant impact. So originally, as you know, these restrictions were put in place where we were seeing very concerning growth. Soon after those restrictions were put in place, the growth slowed down, and now there is flattening. So no, that's not surprising. This is actually how this disease works. This is how these restrictions work. And we know that we are imposing these restrictions in the middle of winter or at the beginning of winter, and we now know that transmission is much more likely to happen during the winter months. So the fact that we are seeing these effects is encouraging and really working exactly when we expect it to work. And again, a testament to the fact that most British Columbians are doing what they can to help us reduce transmission.
We have enough questions to keep you here for another 2 hours, Dr. Gustafson, but that's all the time we have. Thanks once again for doing this tonight. We appreciate it.
My pleasure. Bye-bye.